Mild spit up and reflux are quite common in babies, but how do you know if they're spitting up too much, and what do you do if they are? It's me again. I'm Dr. Ford, a double board certified pediatrician and neonatologist, and this is the feed that you need. When it comes to baby spit up, a regular amount is typically 1 to 2 mouthfuls of breast milk or infant formula during or after feeding or burping. As long as your baby is growing well, sleeping well, and seems content, there's usually no need to worry about their spit up. But if your baby seems fussy or starts spitting up more than usual, then it's best to talk to your pediatrician about options. They may recommend trying a rice starch thickened formula to help. Rice starch thickened formulas have the complete nutrition your baby needs without mixing rice cereal in their formula. Did you know adding rice cereal to formula can offset the nutritional profile of that formula, giving the baby higher calories and carbohydrates than they need with less of the healthy fats? That's why I would recommend an added rice starch formula instead. Some rice starch thickened formulas have been shown in studies to help reduce spit up by more than 50% in certain cases. Because of the nutritional value and other benefits for baby, the American Academy of Pediatrics suggests considering rice thickened formulas before exploring prescription medications. I encourage you to talk to your doctor if your baby has frequent spit ups and if you think they may benefit from a formula switch.